Codeine is a widely prescribed opioid medication, primarily used to manage pain, suppress coughs, and occasionally treat diarrhea. Despite being classified as a mild opioid, it is still a potent substance with the ability to provide relief from conditions ranging from moderate pain to chronic coughing. Codeine is derived from the opium poppy, and while it has been used in medicine for many years, it is also subject to significant risks. As an opioid, codeine works by binding to specific receptors in the brain and spinal cord, which play a role in regulating pain and other bodily functions. While this makes codeine effective for its intended uses, it also opens the door for misuse and dependence, particularly when it is used outside of medical supervision or in higher doses than prescribed. In this video, we'll take an in-depth look at what codeine is, how it affects the human body, and the potential disadvantages associated with its use. Whether you're a patient, a caregiver, or simply someone interested in understanding more about this widely prescribed drug, this overview will provide important insights into both its benefits and risks. By the end, you'll have a better understanding of codeine's role in medicine and the precautions that must be taken to ensure its safe use. Codeine is a widely used opioid medication primarily prescribed for pain relief, cough suppression, and sometimes for diarrhea management. It is a naturally occurring alkaloid derived from the opium poppy, Papaver somniferum, and is chemically related to morphine, another powerful opioid. Although codeine is less potent than morphine, it still carries a significant risk for misuse, dependence, and other side effects when used improperly. Codeine is often found in prescription medications for mild to moderate pain, typically combined with other non-opioid analgesics such as acetaminophen or ibuprofen. Additionally, codeine is commonly included in cough syrups, often in combination with other drugs like guaifenesin or promethazine, to help suppress the cough reflex. Due to its analgesic and cough suppressant properties, codeine has been a part of the medical toolkit for decades. In terms of its structure, codeine is classified as a mild opioid, which means that while it can relieve pain, its effects are generally weaker compared to stronger opioids like morphine or oxycodone. However, codeine still has the potential for misuse, especially when taken in large doses, which can lead to various adverse effects, including addiction. Despite its effectiveness, codeine is classified as a controlled substance in many countries due to its potential for abuse. It is typically prescribed in strict doses and monitored closely by healthcare professionals to ensure it is used safely and appropriately. Codeine's widespread availability, particularly in over-the-counter cough medicines in some regions, increases its risk of misuse and overdose. Once codeine is ingested, whether through a pill, liquid form, or syrup, it is absorbed into the bloodstream and travels to the brain, where it exerts its effects on the central nervous system, as CNS. Codeine works primarily by binding to opioid receptors in the brain and spinal cord. These receptors are part of the body's natural pain management system, which uses chemicals like endorphins to alleviate discomfort. When codeine binds to these opioid receptors, it mimics the action of these natural painkillers, thereby reducing the sensation of pain. Specifically, codeine acts on the mu-opioid receptors, which are responsible for controlling pain and reward. By binding to these receptors, codeine blocks the transmission of pain signals and can induce feelings of euphoria and relaxation. This is why codeine is often sought for its pain-relieving properties and its ability to provide a calming effect. However, this same mechanism is what makes codeine potentially addictive if it is used excessively or improperly. In addition to its pain-relieving effects, codeine is also known for its ability to suppress coughing. The exact mechanism is not fully understood, but it is believed that codeine acts on the brain's cough center, located in the medulla, to reduce the urge to cough. This makes codeine a useful ingredient in many over-the-counter cough medicines. Codeine is metabolized in the liver by enzymes, primarily CYP2D6, into its active form, morphine, which is much more potent in its effect on the brain. While the transformation of codeine into morphine occurs in small amounts, it is this conversion that can sometimes lead to stronger than expected effects, particularly if an individual has a higher than normal level of the metabolizing enzyme, CYP2D6. This genetic variation can lead to increased morphine production, which can heighten the drug's analgesic and euphoric effects, and, in some cases, increase the risk of overdose. One of the key elements in understanding how codeine works is its effect on the brain's reward system. The reward system is responsible for feelings of pleasure and motivation, and it plays a major role in the brain's reaction to rewarding stimuli. When codeine binds to opioid receptors, it triggers the release of dopamine, a neurotransmitter that is closely linked to the sensation of pleasure. This surge in dopamine creates feelings of euphoria or relaxation, which is why codeine and other opioids can be so appealing. While this effect may be beneficial for individuals who need relief from severe pain or who have chronic conditions, the release of dopamine also explains why opioids like codeine have such a high potential for misuse. As the brain becomes accustomed to the pleasurable feelings induced by codeine, individuals may begin to use the drug not just for pain relief, but to experience the euphoria that accompanies its use. Over time, this can lead to the development of tolerance, dependence, and, in some cases, addiction. Tolerance occurs when a person needs more of the drug to achieve the same effect. As individuals continue to take codeine, they may need higher doses to experience the same level of pain relief or euphoria. This escalating use increases the risk of side effects, such as respiratory depression, and heightens the chances of overdose. Dependence, on the other hand, is a state where the body becomes physically reliant on the drug to function normally. When someone who has become dependent on codeine stops taking it, they may experience withdrawal symptoms. These can range from mild symptoms like irritability and anxiety to more severe effects such as nausea, vomiting, muscle pain, and even seizures. Addiction is a more severe form of dependence, characterized by the compulsive use of the drug, despite negative consequences. This is a serious condition that often requires medical intervention, including detoxification and therapy, to help the individual recover. While codeine can be effective for pain relief and cough suppression, it is not without side effects. The side effects of codeine can vary depending on the dose, the individual's tolerance, and whether it is taken with other substances. Some of the most common side effects of codeine use include drowsiness and sedation. Codeine can cause significant drowsiness, which can impair the ability to concentrate, drive, or operate heavy machinery. This is particularly concerning for people who need to stay alert for work or other responsibilities. Constipation. Like other opioids, codeine can slow down the gastrointestinal tract, leading to constipation. This side effect can become problematic for individuals who are prescribed codeine for long periods, potentially requiring additional treatments or lifestyle changes to manage. Nausea and vomiting. Some people may experience nausea or vomiting, especially when they first start taking codeine, or if they take a dose that is too high. These effects can make the drug unpleasant to take and, in some cases, may lead to discontinuation of use. Respiratory depression. In higher doses, codeine can depress the respiratory system, making it harder to breathe. This is especially dangerous if the drug is misused or taken with other substances, such as alcohol or benzodiazepines, which also depress the central nervous system. Severe respiratory depression can lead to life-threatening situations, including coma or death. Dizziness and lightheadedness. Codeine can cause dizziness, which can increase the risk of falls and accidents, particularly in older adults or individuals who are not accustomed to the drug. Itching and rashes. Some people experience itching or skin rashes as a result of taking codeine. This may be a sign of an allergic reaction, which can range from mild to severe. It is important to note that the side effects of codeine can become more pronounced if the drug is taken in combination with other medications or substances, especially those that also affect the CNS, such as alcohol or other sedatives. One of the most dangerous risks associated with codeine use is respiratory depression, which occurs when the drug slows down the body's ability to breathe. Opioids like codeine bind to opioid receptors in the brainstem, which controls basic life functions like breathing and heart rate. When these receptors are activated by codeine, they can cause the breathing rate to slow and, in extreme cases, stop altogether. Respiratory depression is a common cause of death in opioid overdoses. While codeine is considered a mild opioid, it still carries the risk of respiratory depression, especially if taken in high doses or when combined with other CNS depressants. This is particularly dangerous because it can be difficult to detect until it is too late. Signs of respiratory depression include shallow breathing, confusion, blue-tinted lips or skin, and unconsciousness. If an overdose is suspected, it is crucial to seek emergency medical help immediately. The risk of respiratory depression is particularly high in individuals who are not opioid tolerant, such as those who have not previously used opioids or those who take large doses in an attempt to experience a euphoric high. This is why it is essential for codeine to be prescribed carefully and used under the supervision of a healthcare provider. Codeine, like other opioids, has a significant potential for misuse and addiction. While many individuals use codeine as prescribed for short-term pain relief or cough suppression, some may misuse the drug in an attempt to experience its euphoric effects. This misuse can lead to the development of tolerance, dependence, and addiction. Tolerance occurs when a person requires increasing doses of codeine to achieve the same effects. As tolerance builds, the risk of overdose increases because individuals may take higher and higher doses in an attempt to replicate the initial effects. Dependence occurs when the body becomes physically reliant on codeine, and withdrawal symptoms occur when the drug is discontinued. Addiction is the most severe form of misuse and is characterized by compulsive drug-seeking behavior, despite the negative consequences it may cause. Addiction to codeine can lead to a variety of harmful outcomes, including strained relationships, employment difficulties, financial problems, and poor physical and mental health. The potential for addiction is higher in individuals with a history of substance abuse or mental health disorders, but it can also occur in those who are prescribed codeine for legitimate medical reasons. To prevent addiction, healthcare providers must carefully assess the risks and benefits of prescribing codeine and monitor patients closely for signs of misuse. For individuals who have developed a dependence on codeine, Stopping the drug abruptly can lead to withdrawal symptoms. Withdrawal occurs because the body has become accustomed to the presence of the drug, and its sudden absence causes a range of physical and psychological symptoms. Common withdrawal symptoms from codeine include anxiety and irritability, muscle pain and cramps, nausea and vomiting, sweating and chills, insomnia, increased heart rate. In some cases, withdrawal symptoms can be severe and may require medical intervention. It is important for individuals who are dependent on codeine to undergo a gradual tapering process where the dose is slowly reduced over time. This helps the body adjust to lower levels of the drug and minimizes the severity of withdrawal symptoms. The misuse of opioids, including codeine, is a global public health crisis. The opioid epidemic, which has caused widespread harm in countries like the United States, has drawn attention to the dangers of opioid misuse and the need for better regulation and prevention strategies. In some countries, codeine is available over the counter in combination with other medications, such as cough syrups, which increases the risk of misuse. Many individuals may begin taking codeine for legitimate reasons, such as a cough or mild pain, but over time, they may develop a tolerance to the drug and misuse it to experience its euphoric effects. Efforts to address opioid misuse include increased regulation of prescription medications, public education campaigns, and better access to addiction treatment services. Additionally, there is a growing emphasis on non-opioid pain management strategies, such as physical therapy, cognitive behavioral therapy, and alternative medications to help reduce reliance on opioids like codeine. The safe use of codeine requires careful monitoring and adherence to prescribed doses. If you are prescribed codeine, it is important to follow your healthcare provider's instructions closely and avoid using the drug for longer than necessary. If you are concerned about becoming dependent on codeine or experiencing side effects, speak to your healthcare provider about alternative treatments or options for pain management. It is also crucial to avoid combining codeine with alcohol, benzodiazepines, or other CNS depressants, as this can significantly increase the risk of respiratory depression and overdose. Regular checkups with your doctor can help ensure that you are using the medication safely and effectively. Codeine is an effective medication for managing mild to moderate pain and suppressing coughs, but it is not without risks. While it can provide relief for short-term conditions, its potential for misuse, dependence, and addiction makes it a substance that must be used cautiously. By understanding how codeine affects the brain and body, as well as the potential drawbacks of its use, individuals can make informed decisions about their health care and work with their healthcare providers to manage pain and other conditions safely. If you are prescribed codeine, it is essential to follow medical guidance carefully. Be aware of the risks and seek help if you experience any signs of misuse or addiction. By staying informed, you can minimize the risks and enjoy the benefits of this useful medication without putting your health at risk. In conclusion, codeine plays an important role in modern medicine, offering effective relief for pain, cough suppression, and other conditions. However, like all medications, it carries risks that should not be overlooked. Codeine's potential for misuse, dependence, and addiction makes it essential for both patients and healthcare providers to approach its use with caution and care. If you are prescribed codeine, it is crucial to follow your doctor's instructions precisely. Avoid using the drug longer than necessary, and be mindful of potential side effects such as drowsiness, constipation, or respiratory depression. If you ever feel concerned about your use of codeine or experience signs of misuse, it is important to seek help right away. By understanding how codeine works, the risks it poses, and the steps you can take to ensure its safe use, you can make informed decisions about your health and treatment options. Always consult your healthcare provider about any concerns or alternatives to opioids when managing pain or other symptoms. Thank you for taking the time to learn more about codeine. If you found this video helpful, don't forget to like, share, and subscribe for more educational content. Stay informed and take care of your health.